Welcome to our educational video. My name is Dr. James White. I'm an epileptologist with the Minnesota Epilepsy Group. I will be guiding you through our slide presentation. The title of our talk is Choose the Right Seizure Medication for the Patient. The wrong medication can make seizures worse. We are going to be sending this message several times during this presentation. It's really very important, and that's why we really want to stress this point. I would like to start by describing the clinical history of a patient. The patient's history is just absolutely fascinating, and it's also a really excellent teaching case. The patient is a 30-year-old female. She began having seizures at 13 years of age. Her first seizure was described as follows. She was getting ready for school, so she had gotten ready upstairs in her bedroom and walked downstairs into the kitchen. As she was walking across the kitchen floor, she suddenly had little jerks in her arms, and those began to build up in intensity over approximately 2 or 3 seconds. She then suddenly collapsed to the floor and had a full body convulsion. The convulsing activity lasted for approximately 1 minute. She bit her tongue and she was very confused for several minutes. After her first seizure, the patient continued to have occasional breakthrough seizures. The first seizure type was her most intense type of seizure. This is her generalized tonic-clonic type seizure. By the old terminology, this is the grand mal type seizure. She'd have no warning. She would stiffen, collapse to the ground, and have a full body convulsion. The second type of seizure that she experienced was the absence type seizure. By old terminology, this is the petit mal type seizure. For this seizure type, she'd have no warning. She would suddenly stop, stare off, and be unresponsive. The duration for this seizure type is approximately 10 seconds. In addition, she would have myoclonic type seizures. These were brief jerks of her arm or her trunk. At times, she would drop items. As an example, she may be carrying a cup of coffee or her books when suddenly she would just suddenly jerk and drop everything. During the patient's teenage years, as well as her early 20s, she only had relatively rare breakthrough seizures. The breakthrough seizures tended to occur when she was either sleep deprived or had missed doses of her medication. The seizures were noted, especially the intense seizures, only every few years. Unfortunately, as she entered her late 20s, her seizure activity became more intense. Her generalized tonic-clonic seizures were noted often once or twice per month. Also, her absence seizures were increasing in frequency. The patient had a very busy life. She is the mother of 3 young children. She enjoys running 5K races. Unfortunately, because her seizures were becoming more frequent, the seizures were causing her a lot of problems. She was having injuries. She was having to go to the emergency room. At the time that she was having a lot of her problems, she was being treated with carbamazepine. Because the patient's seizures were so disruptive to her life, she really wanted to get better control of her seizures. So she ended up coming to our clinic for a very extensive evaluation. She underwent a detailed history and physical exam. She had extensive laboratory work. She underwent an MRI of the brain as well as video EEG. Her MRI of the brain was normal. Although the patient's MRI was normal, the patient's EEG demonstrated frequent bursts of abnormality. This slide shows the patient's EEG patterns. Each one of the squiggly lines that you see that's kind of flat, that actually represents one of the electrodes that she has attached to her scalp. So what an EEG does is picks up the electrical activity coming from the brain. So each of those electrodes gives you a nice sort of flat squiggly line. What you see in the middle of the slide is that high burst of spiky activity, which is quite abnormal, and she had several of these bursts during her EEG. These bursts are very consistent with a generalized abnormality. It's called generalized polyspike and slow wave activity. The patient's EEG pattern, along with her clinical history, allowed us to diagnose her with a specific type of epilepsy. Her type of epilepsy is called juvenile myoclonic epilepsy. Now, this is a very specific type of epilepsy, and there's a large number of different types of epilepsy syndromes. The key is she had a generalized type epilepsy, which was very important in our consideration of what sort of treatment would be optimal for her. When a patient has epilepsy, one of the most important issues to figure out is exactly what kind of seizures they're having. And one of the most important categories to figure out is whether they're having generalized type seizures or focal type seizures. And the reason this is so important is there are differences in the treatment. So you can actually make some seizures much better if you have the patient on the right seizure medication, and if you have them on the wrong seizure medication, you can make their seizures worse. Now this slide shows an example of what a focal type of seizure would be. The red markings on this slide indicate that the seizures are starting in a very small area of the brain and then spread. So for example, if a patient's having a focal seizure on the left side of their brain, the left side of the brain controls the right side of the body, they might have some twitching in their right arm. That gives you a very good idea that their seizures are starting very focally and then potentially spreading. Contrast that with the next slide, where you can see the generalized electrical activity. So all these red markings are the seizure activity all over the brain, almost like a swarm of electricity all over the brain, and that's what a generalized pattern would look like. Again, it's as if the entire brain would just light up with electrical activity all at once. So it's quite critical that you sort these issues out in a patient, especially if a patient's not responding to the medications. So this information can be very important for a patient. So if you can figure out exactly what kind of seizures they're having, you can give them the most optimal treatment. So you can have a specific treatment for a specific diagnosis. Now in our patient's case, she was on carbamazepine, which is the same as Tegretol. Tegretol was the wrong medication for her seizure type. Tegretol can make generalized type seizures worse. In contrast to Tegretol, Keppra is a very good medication for her generalized type of seizure. And specifically, it is a medication that works well in juvenile myoclonic epilepsy. So the patient was tapered off her Tegretol, which was not an effective medication for her seizures, and started on Keppra. And she just had a great response. Her seizures have been completely controlled with this medication. This has really made a dramatic difference in her life. She is now able to drive. She's able to take better care of her family. She's able to enjoy her running. So she's really very happy with the improvement in the seizure control. When our patient was on Tegretol and her seizures were not controlled, the reason was related to something called pseudo-intractablity. Now I know this is a long medical term, but really I think it's very important that people understand the definition of pseudo-intractability. The definition is seizures are not controlled due to a clinical error. So in the patient we just reviewed, she was on the wrong medication for her type of seizures. So by determining her specific seizure type, it was possible to provide effective treatment. A recent study looked at pseudo-intractability, and what they did is they looked at 100 patients who met the following criteria. Seizures were not controlled when they were initially seen. With changes in medications, seizures were then controlled for greater than 2 years. The results of this study showed that 32% of patients were on the wrong medication for their seizure type. By putting the patient on the correct medication, the patients were completely controlled. So this study is really important in the sense that it underscores how often patients can simply be on the wrong medication, and that if you get them on the right medication, you can make a big difference and they can become completely seizure-free. As we pointed out earlier in this program, Keppra is one of the seizure medications which is good for generalized type seizures. There's several others. As you can see from this slide, Depakote, Lamictal, Keppra, Topamax, and Zonegran are all good seizure medications for generalized type seizures. This slide gives a list of seizure medications which can worsen generalized type seizures. So these medications include Tegretol, Trileptal, Dilantin, Neurontin, Lyrica, and Gabatril. I want to stress these are very good seizure medications. They just may not be the right medications for certain patients, and that's what we really want you to be thinking about. One of the last slides I want to present is about how the wrong medication can really be dangerous. It's not common, but the wrong seizure medication can result in prolonged seizure activity. Most seizures last about 20 to 90 seconds in duration. Prolonged seizure activity, lasting longer than 30 minutes, can occur when the wrong medication is given. So prolonged seizure activity can be dangerous. Can you imagine if someone's brain was having seizure activity going intensely for longer than 30 minutes? That would be a very dangerous situation and could cause neuronal damage that would be permanent. So just want to stress that the wrong seizure medication can be even dangerous in actually rare situations. So in conclusion, for optimal treatment, you need the correct diagnosis and the correct seizure medication. Remember, the wrong medication can worsen the seizures. So thank you for watching our video. If you have any questions or comments, just post them either on our Facebook or our website. Thanks.